Your pet has been spayed or neutered today. There are some very important post-operative steps that you need to follow for proper healing. We'll go over these now. Your pet received a full general anesthesia, so they may be tired, dizzy, and uncoordinated. Please watch them around stairs and high ledges. For dog owners, you may want to help them up into your vehicle when you leave. No running, jumping, playing, bathing, swimming, or other strenuous activity for 10 days after surgery. Dogs must be leashed walked, even in the backyard, so they don't jump off the deck and chase rabbits or squirrels. Short, frequent walks are preferred to long walks. If you have a crate for your dog, use it. Cats should be kept indoors in a small room with their food, litter, and water. If you have more than one pet, it is best to keep them separated. If you have a feral cat, keep him in an enclosed environment such as a barn or a garage for 1 to 3 days before letting him outside. Do not allow your pet to lick or chew the incision. If you have an e-collar or a onesie, it must be kept on for 7 to 10 days. Check the incision site twice daily. What you see on the day of surgery is what can be considered normal. Some bruising, redness, and swelling may develop, but it should be minimal. If you notice any foul-smelling discharge or blood, please call our office. For pets wearing an e-collar, place their food or water bowls away from the wall. With the onesie, make sure you untie it daily to check the incision. If it gets wet or soiled, take it off and wash it. Your pet received internal sutures which are buried and do not need to be removed. Occasionally, external sutures are placed and will need to be removed in 10 to 14 days. We will let you know if this is required. Do not change your pet's diet currently, and do not feed them junk food, table scraps, milk, or any other people food during the recovery period, because this could mask post-surgical complications. Neutering and spaying may reduce your pet's metabolism. In order to prevent weight gain, feeding up to 25% less food is recommended. If your pet is being fed a puppy or kitten diet, they can be switched to an adult food in a couple of weeks. Tonight, offer them 1/3 of their regular amount of food for dinner and repeat at bedtime if hungry. Offer water in frequent small quantities by letting them drink for 1 minute, lifting the water dish and replacing it in 10 minutes. Repeat as needed until no longer thirsty, at which point you can leave the dish down. Your pet can go back to their normal eating and drinking routines tomorrow. Call us if your pet exhibits any of the following: lethargy or depression lasting more than 24 hours, pale gums, vomiting, diarrhea, lack of appetite, discharge or bleeding from the incision, labored breathing, or difficulty urinating or defecating. Your pet received an injection for pain and additional medication to be administered at home. Please read and follow the instructions on the label. If your pet received a microchip today, it has been registered on your behalf. Thank you for entrusting us with your pet's veterinary care.